Clearwater Beach is a sun seeker's paradise.
I've always worshipped the sun. I've always loved the sun and the beach.
For years, Elizabeth Player had a love affair with the surf and sand. It burns strong today.
It gives you a feeling of being alive.
But a couple of years back, the sun's rays caught up with her. Elizabeth says a skin cancer scare years ago forced her to change some habits and get checked by a dermatologist.
In December, I went and everything was fine. And then about April, I saw a spot right in the corner of my eye. I've had other ones checked out on my arms and legs, but never considered right around my eye, that close to my eye.
The spot was basal cell carcinoma in an area typically covered by sunglasses.
It just kind of comes out of nowhere.
I've been seeing more and more cancers and eyelid cancers, particularly in younger patients.
Dr. William Mack is a Tampa-based ophthalmologist. He says Elizabeth is not alone. Over the past 4 years, the number of patients he's treated with eyelid cancers under the age of 50 has almost doubled.
So they have your IV started, so we're going to bring you back to the operating room.
The fix isn't easy. Elizabeth will need outpatient surgery.
So we want to make sure the cancer is completely removed, and make sure that the eyelid functions normally, that the eyelid opens and closes normally, and then of course making sure that the eyelid looks as aesthetically pleasing as possible as well.
The surgery is done in 2 stages. First, the cancer is removed layer by layer.
The goal is to take as little as possible. We know that we will remove all the cancer, it's just a matter of how many stages it requires.
We're with Dr. Mack for stage 2 as he restores the skin taken from around Elizabeth's eye.
My first choice would be to do a local flap where I'm recruiting skin from the upper eyelid, from the lower eyelid.
These days, Dr. Mack performs this type of surgery 6 times a week.
But I think everything looks great.
We're back at his office a couple of weeks later for Elizabeth's checkup.
I don't see any evidence of the cancer returning.
Elizabeth's eyelids are symmetrical and functional.
I could spend all day on the beach. Well, not in the sun.
She's clear to resume her normal activities, especially when it comes to enjoying the outdoors.
I try to do my best to take care of it now. Hire SPF and hat, and stay out of the sun as much as I can.
I'm Dr. Joette Giovinco, Fox 13 News.